Good morning.
Ethics training. Thank you for applying to St. Luke's. So this training consists of scheduling. Is the first part of the training. I'm gonna give you guys some paperwork to help us with the codes and the requirements for the appointment scheduling. These are the codes and the type of doctors that we have, the providers. We have residents, we have 2 PAs, and specialties, but we're gonna focus mainly on the residents and the PAs. So, have any of you guys used or worked with Epic in the past?
No.
No experience?
No.
Have you ever heard of anything of Epic?
No.
Yes,
I
I
haven't.
have.
I had.
Okay. Does anyone wanna read the slide?
I'll read. Epic Systems is one of the largest providers of health information technology used primarily by large U.S. hospitals and health systems to access, organize, store, and share electronic medical records. Epic logo.
Thank you. So in scheduling, what do you guys think is the first and main priority?
Organization.
Yes, that's one.
Find out what's their timing.
In the customer service.
Just making the experience short, simple, and effective.
Good one.
Something more.
Find out what time works best for them.
Patient, client satisfaction.
Okay.
So we want to make the experience for the patient happy, so that they have, when they leave the office and or they hang up the phone, they have a good experience so they can continue to come back. So I'm going to show you guys a quick video, just to give you a little intro in regards to
Just take-
scheduling.
Take your forefinger this way. Yeah.
No quiero que el teléfono primero, aunque ya lo vean.
Yo se lo voy a mandar ahorita. Happy customer.
Yummy. Merci.
Gracias.
Thank you.
¿Qué quieres hacer, dear one?
Okay, so any questions, any feedback in regards to the video? Do you guys, what if you put the, do you guys have any experience that you guys can remember whether it was good or bad that it impacted you on how you feel in regards to the company you went to?
Say that again. Say that again.
Wow.
Because you were saying that as he was doing that for you.
Okay, so any comments or any questions in the video?
I think it was a really good
Yeah, I
video.
think
Yeah, it was self-explanatory.
Does it remind you of any experience that you guys been through at any company?
Oh yeah.
Yeah, McDonald's, they give you the food and they don't say have a good day.
I thank you.
And how does that make you feel?
Like I never want to go back.
So
When I
what,
go back.
so let's, McDonald's, what would have made it different for you that and would make you want to come back?
If they greeted you with a smile.
Yeah. Or if they asked me if there was anything else they could do.
Or just that they weren't rude.
Yeah.
Okay, so it's the little things that matter. They come a long way. You wouldn't think eating in front of a patient or customer would be rude, but it's not recommended. It's not appropriate. Because you can make the patient feel as if you're rushing them. You have to go to lunch, and you're not giving your full attention. So moving on. First key is making sure that we provide an excellent customer service to the patients, to every patient, every single time. So Epic allows us to schedule appointments, making it the easiest and very convenient to understand the schedule. So this is our schedule. As you can see, we have a lot of providers. We have 13 residents that rotate. We have first year, we have second years, and we have third years, plus the 2 PAs. So for the first year, as you can see, their appointment time is 60 minutes. Third and second are 30 minutes. But Epic allows us, just by putting in the code, to already have that appointment time scheduled in for you, so you don't have to focus or worry about if you put in the right time, because the codes do that for you.
Okay.
So this is what our schedule looks. This is what our snap board looks like. This is our schedule for all the residents for the day. You could change it, and you can view it for the week. You can view how many providers you want. You can tweak it. This is where you're gonna select the provider, and in here, visit type is where you put the code. So the system automatically knows the time that it needs by the code that you put. So we also have same days. So this is how you can determine what a same day is. So for the same day, the code is same day. On this screen is a cheat sheets that we have to help you determine which code and which doctor you need to schedule with. So for the PA, if it's a new patient, it's a new patient appointment. A PA appointment is 40 minutes. For the first year resident is an hour. Second and third is 30 minutes, whether it's a new patient or not. For a follow-up appointment for the PA is an OVS. It's 20 minutes. Do you guys have any questions?
Yes, I do actually. When it comes to the first year, second year, and third year, is this explaining the information of the medical history of the patient?
Okay, so this is just one part. So here is where you're gonna look up the page. So if you see here, all the tabs are on the top.
Okay.
So if you click on appointments, a little screen is gonna come up. It's gonna ask you to put patient's name, MRN, date of birth, phone number, social.
There we go.
So if a patient calls you on the phone, what do you think is appropriate to ask them on the phone to plug in the information to look up for the right patient?
His name, date of birth, and maybe address.
Correct. So either or. For me,
You can't ask social over the phone, right?
if it's a new patient, the system requires it. Sometimes patients don't feel comfortable, so it allows you to just plug in zeros. But then when the patient comes in, you will have to put the correct information in.
Okay, is this something that we ask while we're on the phone?
No,
You don't ask the patient?
you can, if the patient feels comfortable giving it to you over the phone, they'll give it to you. If not, just plug in the zero onto the next question.
Okay. How about once you're done with the patient at the end of the day, how do you close them out? How do you know that they need more time, or what time to put them in? Is it the second year? Is it the third year after they're done?
Okay, so if it's a new patient, you can choose whichever doctor is available, the sooner the better. If a patient has a specific day, I want to come in this day, then you see which doctor has the appointment available that day, ECK.
Is that on
this screen. On this one.
Okay.
Also,
So you're gonna put visit type, which is new patient, and then the provider. An easy way to know which doctor is gonna be on a specific date, you're gonna go to the snap board. You go here. You put
Hey,
it.
what's the difference between the red and the green?
Okay, so red is already scheduled.
Okay.
It's
and then
taken.
green is free
So
time.
your greens are available. So let's say a patient calls, oh, I need an appointment on January 1st in the morning. So you're gonna change your date on the bottom, December 1st, and it's gonna show you.
Gotcha. And then that's how
Well,
you know the availability
And
of the
then,
doctor.
if you need an OVL, how long is an OVL appointment?
30 minutes?
And if it's a new year resident?
45?
60.
Okay.
So if you need 60 minutes, by putting the code, the system knows. But for you to know that you're gonna plug that in, you need to know that if it's the first year, it's an OVO, you need 2 slots. So let's say Jasmine calls, she needs an appointment, she's a new patient, she wants to come in January 1st. new patient, you know, is 2 slots. So you're gonna look at whatever, all your greens, and they need to be together. Where do you think you can fit in Jasmine based on the snapper schedule?
At 10 a.m. I don't see the date.
No,
Where? Right
12
here?
on Tuesday? 12 p.m. Tuesday?
Let's see. 12 on Tuesday. Here?
This
Right
one,
here.
Or is this Monday? Right here.
No,
So I see 12 p.m. as
No.
open.
but you see there's no provider here.
Oh,
you-
so if it's
there
empty,
has
there's
to
no
be-
provider.
So you're looking for the two
Green?
for the 2 green slots together.
So it'll be 9 a.m. on Wednesday.
Jasmine, we could put her either on here, which is Dr. Rahman at 9. We could put her at 12:40 with Dr. Brian, she's the PA, so it'll be 40 minutes slot, but she still needs 2 slots, because each slot for her are 20 minutes.
Gotcha.
We can put her here, and here, and here. So we have a few options for Jasmine. So, we will give you after the training the cheat sheet, so you guys can have it for reference. So you're gonna keep this to help you look at, reference to schedule the appointment.
Now, can we cancel, reschedule, and check previous appointment times
Yes,
with this? Okay.
of course, yes. Why do you think it's important that we use the correct code, and when we give patients the information, that we're giving them the correct information and plugging in the correct information?
To not get it mixed up with the specialist that's gonna be seeing them.
Yes. Also, you don't want to call a patient and say, I scheduled you wrong, I need to change the appointment. Now, patient made arrangements,
And back on
they
the
requested,
service.
exactly. It doesn't look professional.
Correct.
Any other questions you guys have?
No, that'll be all open.
We're gonna role play, just to put into practice what you guys have learned in this epic training for scheduling. Any volunteers? Who do you wanna be?
I
The
wanna be
patient?
I want to be the patient.
Okay, so let's do it like this. I'll be the receptionist scheduling the appointment. Do you wanna do over the phone or you wanna do face to face, like if you're coming into the
Face to
office?
face.
Okay, then you'll be the phone
I'll
call.
be over the phone.
Alright, so I'm gonna take a seat. Can I help you this morning?
Hello, I'm here because I wanted to schedule an appointment with Dr. Benai.
So you've been here before, correct?
That's correct.
Alright. Can I please have your date of birth?
05/17/1992.
Last name?
Foster, Foster.
First name is Felipe?
Yes.
Okay, Felipe. So you've seen Dr. Benai before.
Yep.
How soon would you like to come in to see Dr. Benai?
What is the soonest appointment you have
Soon
available?
as available? Sometime this week?
Yes.
Okay. I could do tomorrow. I have a 8 o'clock appointment.
Do you have anything like 10 o'clock?
10 o'clock I can do tomorrow, Tuesday.
That sounds good.
Okay. What's the reason for the appointment?
I have abdominal pain.
Okay. Okay, Felipe, you're all set for Tuesday, 8 o'clock with Dr. Benai. Anything else I can do for you?
No, that's it.
Okay. Here's a copy of your appointment time. Any question need to be scheduled, you can call us back.
Oh, wow, thank you. You're very helpful.
Thank you. Have a great day.
Likewise.
Okay, so now on to the next one. We're gonna do a phone call appointment. What's your phone? Okay. Ring ring. Thank you for calling Star Wellness Southside. Captain speaking. How can I help you?
Hi, good morning, Catherine. I would like to schedule an appointment.
Sure, I'll be glad to help you. Have you been here before?
Yes, I have. I would like to do an appointment to get my blood work and a physical.
Okay, so it's a follow-up appointment physical. The physical, do you need any forms to be completed?
No.
Okay, can I please have your date of birth?
1988.
I'm sorry, can you repeat that one more time?
1988.
Okay. Last name, please?
Aquino.
First name, I have Pedro.
Correct.
And Mr. Pedro. Okay. So how soon would you like to come in to see the doctor?
As soon as you have availability. And if evening, if possible.
Okay, perfect. Sometime this week?
Yes.
Okay. I can do Wednesday. I have a 3 o'clock appointment.
That sounds perfect.
Okay. Okay, that's. Okay, Mr. Aquino, so you're all set for Wednesday, 3 o'clock p.m. If you have any questions, you can give us a call back. Is there anything else that I can do for you?
Do you happen to know what doctor I will be seeing that day?
Your primary doctor, Dr. Malone.
Oh, okay.
Is
All right.
that
Thank
okay?
you. Yes, that's perfectly fine. Thanks a lot, Catherine. You've been a great help.
Have a good week. See you soon.
And bye.
Okay. So, do you guys have any feedback on your experience at, so based on your experience,
Take your time.
okay,
Sorry,
do you guys have any feedback on your experience when you called the clinic to schedule your appointment or when you walked into the office to schedule that appointment?
No, I felt that you addressed all my concerns, my questions. You even tried to work on me when I couldn't do Monday. At I think it was 8 o'clock. So I think everything went well.
What about you, Pedro?
With my phone call, your tone of voice was smoothing. The way you picked up was very joyful. I had a great experience. You answered all my questions before I even had a question, so it was good.
Okay. Thank you guys for the feedback. I appreciate it. So next step in the training, we will continue to do more role play just to give you guys the practice that you need and getting comfortable with the codes. Because most important, besides good customer service, is getting the codes right and the providers. We want to keep the amount of mistakes to a minimum to avoid having to call a patient back and change the appointment. Also, providers, they get really upset when you schedule a patient that's not theirs. We want to keep that patient care every time a patient comes in to continue care with their provider.
So when that happens, I'm sorry to cut you off, but when that happens and we schedule a patient to the wrong provider, is there like a repercussion for that? Do we get in trouble or something like that?
No, you just put it on the notes.
Okay.
Sometimes patients want to come in sooner and the doctor's not available. So obviously customer service is priority. We're going to try to accommodate and get the patient as soon as they need to be seen.
No matter what doctor's available.
Correct. We've added in the notes, so just the when they do the pre-regis the week before, the MA that helps the provider has all that information so that they can prepare for that visit before the patient comes in. So we are the head of the train.
Okay.
If we start off well, it's a smooth ride. If
Okay.
we mess up at the front, obviously it affects the back.
Okay.
So this system practically everybody sees it.
Yes, we all have
Meaning
that. Yes.
the front, the back, the doctors, everybody sees it.
Yes.
Oh, okay. Now I understand why.
We each have different access, but we see the appointment time, and the patients. So they can, by seeing the patient that is scheduled on their schedule, they can go to the chart review and see what is the appointment for. Review the chart so when the patient comes, they know how to take care of the patient.
Now, when you say different access, do you mean that they have a different layout of the program than what the front does?
Yes, it's
But we don't get to see their access the way that they don't get to see our access.
No. Okay, so there's different tabs. We have the appointment desk, which is what we mostly use. Then we have the chart viewer, we have referrals, we have medication. It's all tabs that we all have access to.
Okay.
Now, on let's say lab results, we can, me as a medical receptionist, I don't have access to add any notes. The MAs and the providers do. But we can see what they type. So the patient calls and they have a question, if we have that access, we can relay the information to the patients.
Gotcha. Instead
Now-
of having the MA do it, you can do it. Or
Yes.
we can do it.
Sometimes it happens that a patient calls, they need lab results. Sometimes it's normal, so if you feel comfortable saying your lab results are normal, you can relay the information to the patient. Now, if it's that abnormal, you're actually gonna take the information, send it to the MA, and have them take the call, because that
Oh.
is beyond our scope of work.
That was my next question. What if I needed to get in contact with the MA?
We will transfer the call to them.
Oh, okay. All right.
So for the most part, we do it all, but for this part of the training, it's just scheduling, because it's important that we get all the patient's information correct, the type of visit, and the correct provider, to make it easy smooth for everyone else.
Gotcha.
Okay? You guys have any questions, any concerns in regards to the codes? And obviously, the more you do it, the better you'll get.
Correct.
More, our residents rotate every 5 weeks, but you will always we send weekly cheat sheets that will help you identify which providers here that week.
Okay.
And you have the snapboard that gives you all the providers.
Now, what do we do in the situation where if we have a hostile patient, where he's not patient, he's not willing to work with us, and he's just being a straight up ignorant person? How do we?
You
How
mean
do-
if a patient calls or they come into the office?
No, they come into the office. How do we manage that? Who do we call? Do we call management? Like, what happens in that
Well,
situation?
you would try to take control of the situation, try to help and accommodate the patient because obviously customer is always right.
Correct.
If the patient asks for the manager, then that's when you will call either the coordinator or the manager. They're always in office.
Okay.
Okay?
Okay.
But that'll be for later on in the training. Right now it's just focused on the scheduling.
Okay.
Okay? And for this part, we are done. Thank you so much for your time. See you soon.